guys, this is Dr. Hub. Now we look at the gallstones and we are focusing on the types. So here, you start with the cholesterol gallstones. So here it is mainly present in the west. And where is it located? It is located in the gallbladder, as well as it is present in the ducts. Next comes the RF. What is RF? RF stands for the risk factors. So the risk factors, there is nothing but in case of the advancing age, then in terms of female, in terms of the OCP and pregnancy. Next, what are the other risk factors? There is obesity, as well as the insulin resistance. This insulin resistance. Then comes the rapid weight reduction. There is a rapid weight reduction, as well as the gallbladder stasis. The gallbladder stasis, as well as the dyslipidemia syndromes. There is dyslipidemia syndromes. Next, let's look at the appearance of the cholesterol gallstones. So appearance wise, it is a pale yellow, and it is round. It can be round. It is round to ovoid. Then it is finely granular. As well as there is a hard external surface. There is a hard external surface. Next, let's look at the transection. So under transection, it includes, there is a glistening, radiating, crystalline palisade. It is glistening, it is radiating, crystalline and palisade. Now let's look at the constituents. So it contains the cholesterol from the name, and there is the phospholipids, as well as the bile salts. So how is the consistency of the cholesterol stones? So consistency is nothing but it is crystalline with the nucleus. It is crystalline, and this is with the nucleus. And what about the percentage of the radiopaque stones? The percentage of the radiopaque stones. So this is nothing but it is 15%. Next we move on to the black pigment. So under the black pigment, the demography is that it is present in non-Western countries. And how is the location? The location is that it is in the gallbladder, as well as the ducts. Next we move on to the RF, that is the risk factors. The risk factors of the black pigment will be the chronic hemolysis. Then there is also the ileal resection. And then there is also the cystic fibrosis. And this cystic fibrosis will be along with the pancreatic insufficiency. This is along with the pancreatic insufficiency. Next we look at the appearance. The appearance will be greater than 1.5. This is in the diameter. Then there is also the friable speculated, and it is molded. So the appearance wise, it is greater than 1.5 centimeters. As is in diameter, it is friable, speculated and molded. So what are the constituents of this? The constituents is that it includes, there is a calcium bicarbonate. There is calcium bicarbonate. And then there is also the calcium bilirubinate. So all calcium are present in the bile pigment. Next also the calcium phosphate. Then comes the consistency. consistency is hard, and then comes the percentage of the radiopaque stones. So this will be about 60%. Lastly, we look at the brown pigment. So brown pigment is present in the non-Western countries, that is the NWC. So let's look at the location. So in terms of the location, it includes the ducts. It includes the presence of ducts. Then let's look at the risk factors. So risk factors is that it includes the chronic biliary infection. There is chronic biliary infection. Then we're looking at the appearance wise. There is greater than 1.5 centimeters, and this is in diameters. It is friable, as well as it is friable speculated, and it is molded. So this was about the black pigment. So in terms of the black pigment, it was greater than 1.5 centimeters in diameter, is friable speculated and molded. Whereas in case of the brown pigment, in terms of the brown pigment, this is going to be, it is large, it is brown, as well as it is laminated and soft. So there is no specific measurement. The specific measurement was only given in terms of the black pigment. So now we are discussing the brown pigment, and next there is the calcium bilirubinate. So these are the components of the brown pigment. So there is the, let's write it down, calcium bilirubinate. Then comes the presence of palmitate. This calcium bilirubinate, this palmitate, as well as the presence of the cholesterol. Next we look at the consistency. Consistency is going to be soft and friable. And what about the percentage of the radiopaque? Percentage of the radiopaque stones. This is going to be 0%.